Good afternoon, and thank you for joining us here on another Black Doctor Facebook Live. I am Ellis Dean, the Director of Digital Programming for Black Doctor, and we are really excited to have this program because this is a program that is not one that's in typically that we do, but this is very important with regards to your overall health and wellness. Today, we're going to be talking about your liver and your liver functioning. Now, if you're like me, the only time you think about your liver is when you've had too many things to drink, or if you know someone that may or may not have had hepatitis, or if you've had to have a hepatitis vaccine with regards to work or anything like that. So, but did you know that there are over 100 different types of liver diseases? And so I did not know that. More than 1 million Americans are infected with hepatitis B. At least 30 million people, or 1 in 10 Americans, have some form of liver disease. And like I said before, there's like over 100 types of liver disease. And so today we're going to really kind of get into what the liver, functions, how it functions, what its functions, and what it handles in our body. I think it's really important that we get to know that. And then we're going to give you some tips and tools on how to keep your liver functioning at its optimal level and things that you might need to talk to your primary care physician about. So I'm really excited, and I think you should really kind of pay attention to what's got going on. So just a couple of instructions before we get started with our program today. First, we'd like to know where you're watching from. So if you would put that in the comment section, let us know where you're watching from. That's always good to see people where to watch from. Number two, if you know somebody that needs this information or that could use this information in their life, please tag them and let them know, or share this program once it's done. Once we get done, and say, hey, look, you need to watch this. And number three, please take as many notes as possible so you can be your own best health advocate. We are all about getting the information that we need in order to increase our healthy lives. And so those are the three things. And then I got one quick brief segment that we're going to bring on our guest. And I want to say that the American Liver Foundation, who is our co-sponsor of this event, would like to thank the sponsors for their support of this Focus on Black Health series on liver disease and liver cancer. That is the Psy, Bausch Foundation, Genentech, and Merck. So I just want to kind of thank all of our sponsors for this particular programming. So no further ado, I'd like to introduce our guest, and that is Dr. Gunn.
And I'm going to give you. Thank you for having me.
How are you doing? I will give you your full weight of how important you are. So Dr. Gunn is a gastroenterologist and hepatologist and focuses mainly on finding therapies for liver-related illnesses. She is also a certified principal investigator by the Association of Clinical Research Professionals, and her work concentrates on linking cutting-edge clinical trials in non-alcoholic fatty liver disease and gastrointestinal illnesses to the populations who need them desperately. There's a whole lot more, but let me just tell you something. Dr. Gunn knows what she's talking about. So I'm going to summarize the rest of this by saying Dr. Gunn is the person you need to be talking to if you got some liver problems. So welcome, Dr. Gunn. How are you?
Thank you so much. So happy to be here, and I just can't wait to share my knowledge and hear from the audience about their concerns, of course.
Absolutely. And we've got people from all over Mississippi, DC, Atlanta, Cincinnati, Montgomery. So keep dropping your cities, give your hometowns a shout out throughout this program. And so want to ask the first question, and this is probably the most obvious question that is out there, is why is the liver so important?
Well, Ellis, the liver is probably, well, in my opinion, the most important organ in the body. It really is a masterfully crafted organ. It is one of the few, if any, organs that if you cut it in half, it can regenerate to its full size in under a few months. So It's a very important organ. And what it does is it really is the powerhouse of the body. It detoxifies, it cleanses. Everything you eat, everything you drink, every pill you take has to metabolize in some way and filter through this organ. And so that's why it's so very important. It helps us with our protein. It helps us with our blood clotting. It helps us digest the foods that we eat. There's really not much the liver doesn't do. And that's why it is really critically important.
Wow. So The liver is the body's detoxifier. That's the number one thing. So all of those bad foods that we eat, all the things that we drink, everything that we put into our body, the liver takes those toxins out and helps us either process them or it helps us get rid of them.
Absolutely, yes.
Okay, so well, we could stop right there. Liver health is just so important because it's a detoxifier. That's the number one thing. So, but I know there's more than that. That's just kind of what the liver does. But what are the risk factors for liver disease?
Well, that's really a important question. It's a very comprehensive one. So there are a lot of things that can affect the liver. So viruses, for instance, like hepatitis A, hepatitis B, hepatitis C, and there's even a D and an E. Those are viruses. They're autoimmune conditions where you don't even know how you got it, but suddenly your body is attacking the liver. So there are autoimmune conditions, and just to name a few, there's autoimmune hepatitis, primary biliary cholangitis, primary sclerosing cholangitis. There are so many different autoimmune liver diseases. And my particular disease focus is fatty liver, non-alcoholic and alcoholic fatty liver. So when you drink in excess, you can really harm the liver. And those who don't drink are susceptible to liver disease if they're diabetic, have high blood pressure, high cholesterol, or as many of us are, even on this panel and probably in this room, overweight or obese.
Right.
Those are all risk factors for developing liver disease. And it's really unfortunate because in those, people tend to think, okay, I had to have done something wrong. I had to have used a lot of drugs in my life and I got Hep C, or I had to drink in excess and got cirrhosis from that. But now with non-alcoholic fatty liver disease, you're looking at grandma who just cooks the beans and the greens and the chicken, the fried chicken and everything. And then she too can be susceptible to liver disease, having done nothing, I guess, chemically to her body.
Right. That's fat, that non-alcoholic fatty liver disease. Wow. Okay. So is it something like that we should be worried about later in life, or is it something that it can strike us at any age?
At any age. We're seeing even in the pediatric population, preponderance of non-alcoholic fatty liver disease in our children. And it's primarily because, well, there's probably some genetics behind it, but there also is a lot of the things that we do environmentally, the foods that we eat, the high fructose corn syrup, that Kool-Aid and a bag of Doritos. That if that's that standard meal in that family, that's really setting up the children for conditions like non-alcoholic fatty liver disease.
So wait a minute, you said the Kool-Aid and the Doritos. Come on now, you hit too close to home right now, Doc. So
I know, but this is the diet that which we want to avoid. We want to incorporate, even in the young children, a healthier lifestyle, healthier choices in the foods that they eat, more fruits, more vegetables, proteins, nuts, seeds, reaching for snacks that aren't loaded with carbohydrate, simple carbs, or high sugars for that matter.
Well, in all seriousness, I think you're touching on a point that is really kind of problematic in the Black community, and that is food deserts. And so when we're talking about social determinants of health with regards to Black populations, many Black populations live in areas where there aren't a lot of fresh food options available to them in the neighborhood. They've got to go travel outside of the neighborhood and may have barriers to going outside of the neighborhood to get those fresh foods and vegetables. This is actually problematic because the corner stores right there.
Right.
And corner stores got the salt and vinegar chips, and they've got the Doritos, and they've got the juice boxes and all those drinks that have a lot of that high fructose corn syrup. And so when we're thinking about it from that perspective, we've got to do a better job in terms of training ourselves to search and eat healthier snacks in order to preserve our functioning for longer periods of time.
Right. I agree. And it's just unfortunate too, like you mentioned, those food deserts and the affordability of foods that are healthy is really a problem. You can't get salads and and fruits at a low cost. I know in our community here in Waco, Texas, we have grocery stores that are essentially supplied by those who are donating either resources extra from the grocery stores and making those food products more affordable so that we can help our communities live healthier.
Yeah, and then you think about it, if you can get the fresh fruits and vegetables, you got to be able to store them and they don't keep very long, right? And
That's
so
true.
you got to have, you know, sometimes if you're working long hours, if you're working double shifts to try to make ends meet, having, you know, fresh foods in your home, it may not last as long because you don't have the ability to cook every night, and so you're eating out more. So there's a lot of factors that play into what we put into our bodies, but we're really kind of focusing on, you know, how we can kind of help improve our liver functioning and protect our liver functioning, because as we stated at the top of this program, it is the detoxifier of the body.
Right.
And so there's a question, because, you know, I'm not a baby boomer, but my mother is, and there was some data that said that baby boomers are more susceptible to Hep C. Do you know why that is?
So we looked at this, and so the baby boomers, just to kind of clarify, that's the population that was born between 1945 and 1965. And we really made a campaign in the last few years to really look into that population, because we were just recognizing what Hep C was in probably the early 90s. And over the last few decades, have developed treatments and cures for hepatitis C. But we found that the population that was seriously affected was that 1945 to 1965 birth cohort. And our rationale for why that might be is that was kind of the hippie period, that free love, that IV drug use, a lot of sex and alcohol and fun times. And then these people were living unsuspecting of any problems. And then suddenly, when hepatitis C was recognized, they had this condition. And some of them had already progressed to cirrhosis and liver failure. Liver transplantation was required. And so we really had to go back and screen that whole group of people, find out who was affected with hepatitis C, and provide them with treatments. And for those of you in the audience who don't know, hepatitis C is now a completely treatable condition. There's single tablet regimens, one pill once a day, for a very short period of time, like 12 weeks, and you can eradicate the virus. So we've really made some huge breakthroughs in that disease.
Well, that's really good to know. I guess the question, just in a general sense, so hepatitis is a virus.
Yes, hepatitis. Well, there are viral hepatitis. So there are, and then hepatitis, let me just to break it down. Right. Hepatitis just means inflammation of the liver. So now, what is the cause of the hepatitis? It could be a virus. It could be an autoimmune condition. It could be fatty liver. It could be alcohol. All those things can cause hepatitis. So that's really important to kind of differentiate. When you say hepatitis, all you're meaning is that you got a swole liver. That's all. But then what the cause is, what the underlying reason for it is, it could be a virus. Hepatitis A, B, C, D, E are all viruses. They could be a different kind of virus. It could be a herpes virus or a varicella virus. Lots of different viruses can cause hepatitis. And then, of course, the other things are autoimmune and alcohol and drugs, etc.
Okay, because I was always wondering that, because I mean, I just saw the hepatitis with the alphabet soup behind it, and I just didn't know, you know, what it is. And I don't want to even try to go down the path of what is A, B, C, and D. Yeah. But just in terms of understanding, hepatitis is inflammation of the liver. And as we know, those of us that just took Body 101, Science 101, inflammation is bad in the body. So if you have any type of inflammation, it's probably not good. And so when the liver is inflamed, then it could impair its functioning, and then therefore that could impact the overall body and health of others. So
that's right. And whenever the liver is swollen or in hepatitis, now you're starting to put the liver at risk for scarring. And that scarring, we call it fibrosis. So fibrosis is broken down into 5 stages. 0 means no scar. Fibrosis stage 1, early scar. Stage 2, a little bit more advanced. 3 even more so. And then the last stage is stage 4, which is also known as cirrhosis. So whenever you hear the term cirrhosis, that means that the liver is as scarred as it's going to get. And now you have a very shrunken down, scarred to a rock liver that now has the potential to stop working. And that is where we run into trouble.
Okay. See, man, this is fascinating because I promise you, this is information that I did not know, and I think I'm hoping our audience, I hope they're getting something out of this. So if y'all are getting something out of this, let us know. We are talking to Dr. Gunn out of Waco, Texas. We learned that from Waco, Texas. So don't go knocking on the door. I'm saying make an appointment if you want to see Dr. Gunn. But we are really talking about liver functioning, liver disease, and potential liver cancer as part of our series with the Liver Foundation. And so if you want to get more information, you can see scrolling along the bottom of the screen is liverfoundation.org. That's their website to get more information about liver functioning. So absolutely. So hepatitis is inflammation of the liver or swelling of the liver. There's levels to this, and that's called fibrosis. I want to make sure I'm getting that right.
For scarring, yep.
Scarring on the liver, and then it goes from 0 to 4 in terms of the scarring on the liver, 4 being that cirrhosis type level to where your liver is basically on
E.
It's on E. You've worn it out if you got to level 4 on scarring on your liver. And so I know we're smiling, but these are very serious areas that we're discussing. We're talking about the liver functioning, and as we mentioned at the top, this is your body's detoxifier. And so if that's not functioning properly, then the body doesn't detox well, and all of those toxins can remain in the body. And we all know that toxins are the step between cancer forming, potential cancers forming in the body, and other ailments and illnesses forming in the body. So the liver serves as a very, very important role in terms of keeping our body clear of toxins that we put in them, by eating a lot of foods that aren't good for us. So there was a question from Maurice, who's been watching us on Facebook, and he wants to know, what's the best way to detox the liver? Are there any foods, or are there ways that we can kind of restore our liver function? I know once it's a scar, it's hard to remove it, but is there a way that we can kind of get our liver back to more optimal functioning?
So I love this topic, and our bodies naturally cleanse themselves. And what I would hate for the world to do is to run up into a nutrition store, a box nutrition store, get in the aisle and go to find the liver supplements and the liver health cleansers and put themselves into harm's way. We don't know too much about what is on the shelf, non-FDA approved pills and herbal supplements that we're putting into our bodies with the hope that it's going to cleanse the liver. But what I do know is that many of those things have hurt the liver and have put people in the hospital in what we call a DILI, which is drug-induced liver injury. And these are coming from products that are very available at these health food stores, at these grocers, and you're thinking that they're going to do something positive for you, and you end up in trouble. I will tell you a story, and this is one of my favorite stories to tell. Well, it's an unfortunate one, but it does help to set the stage for my people that are strong believers in detoxifiers and cleansers and supplements, and they've got a whole pantry full. I was active duty military. I did my training in the Air Force several years ago. And some of the guys who wanted to pass their PT test would wrap themselves in garbage bags, run the track mile after mile so they can sweat and they can make weight. And they would take, I'm not going to mention the product because I don't know if there's like a conflict there, but they would take a available product at the grocery store, health food store that's claimed to fame is rapid weight loss.
Right.
And so they would take these pills, go run the track, wrapped in a bunch of heat producing garments or whatever.
Right.
And he was a 32-year-old guy, young family, comes in jaundice, encephalopathic, meaning very confused, and in complete overt liver failure.
Oh, wow.
And he did not live very much longer after that. And it was because he had been taking something that was some formulation at a health food store with no idea what it was doing to his liver. And so to your question, is there a cleanse? Is there a detoxifier? Is there something that you can do to cleanse the liver? And the answer is no, outside of living a healthy life, eating the right foods, avoiding alcohol and keeping it to a limit in our bodies. Even though alcohol is so widely available, it's our social interaction tool, so it's hard to really keep it under control, but do be mindful of how much alcohol you're taking into your body, and even your day-to-day medications. Always revisit what you're taking and for what reason. And is there any way to maybe take away some of those medications? You go say, hey, Dr. Smith, I've been on this medicine for 16 years. Do I still need it? Like, why am I still on this? Aren't I better? So we do need to make sure that we're always our best advocate. We're living healthy lives. We're eating nutritious foods, and we're avoiding any chemicals to our body that could hurt our livers.
All right. So Maurice, thank you for that. He said, love it. Thank you. And I just want to kind of summarize for folks. Take supplements at your own risk, because in most of them, if you turn it over, they're not FDA approved. And so, I had a friend, I'm not going to say the name of the supplement, but he was like, oh man, this is great, man. I take this every time I drink too much. I just take this and it helps, help clears your whole body out. I'm like, and I almost took it, but I was like, yeah, I'm gonna stay away from that.
Yeah, how about you don't drink? Right?
Like, I don't think that was an option. I think the option was, okay, if I'm going to drink, I'm going to take this to help clear it out. Yeah. So the only supplements I take are like vitamin supplements to kind of, because I know, a lot of Black people are vitamin D deficient. And so that was one of the things that I had taken, and some other vitamins. But
to that point, Ellis, yes, there are vitamins that our bodies do need. But usually we as physicians can test for deficiencies and prescribe those that are necessary, like D and B12. Okay. Those are all ones that we routinely test for, and we can supplement. But those are under the direction of your provider, not you just going to the store and just supplementing just for the heck of supplementing.
Yeah. Right. So I think that's interesting. It kind of got off track a little bit. So there was another question, and I know I'm mixing in this question. We were saving it for the end, but there's really some good questions. So does cirrhosis lead to liver cancer, or is that a different path? Is liver cancer a different path from the cirrhosis path?
So that's an excellent question. So ideally, or I guess the most popular way to develop liver cancer is having a background of cirrhosis. So we know that path very well established, that once you have cirrhosis, it is a requirement. It is a guideline in the medical literature that we have to screen for cancer every 6 months. Once you've had cirrhosis, cancer is kind of lurking in the background. So you have to look for it. But can you develop liver cancer in the absence of cirrhosis? And the answer is yes, you can. We don't readily look for it, but we do look for risk factors. So if I have somebody who has fatty liver disease and I don't believe they have cirrhosis yet, but I do believe the liver is in trouble, I'm anticipating that they have some fibrosis, some scarring, then I might look for cancer periodically. But the hard, fast rule is if you have cirrhosis, you do have the risk of developing liver cancer, and it has to be looked for. However, in some instances, we have seen liver cancer develop kind of spontaneously. And although our guidelines don't suggest that we look for it, you just have to keep a very open dialogue with your provider, so they're looking for signs or symptoms or clues that tell us that there's something going on that we need to look into further.
Okay. Wow. All right. So if you're just joining us, we are talking to Dr. Gunn, and she is a gastroenterologist and hematologist, hepatologist, sorry. And we are talking about your liver function. So we're talking about liver disease and potentially liver cancer. So we're kind of breaking down what your liver does, which is it's in the shortest version is summary is the body's detoxifier. It does more than that because it produces cholesterol and all this other stuff for your body. But the shortest version is it's your body's detoxifier. Then we've been talking about different diseases like hepatitis is really just an inflammation of the liver, and that inflammation can be caused by multiple things: viruses, alcohol, immuno deficiency, all types of things, but it's all underneath that hepatitis umbrella. And then as we continue to do damage to our liver in a variety of different ways, it causes, it's fibroids? No.
Fibrosis.
Fibrosis.
Scar tissue.
There's levels of fibrosis that up to 4, and 4 is that word that you've heard before, which is cirrhosis, and that's the highest level, and that's severe scarring of the liver. And that, as we just learned, can lead to cancer. So if you get to that cirrhosis level, you're going to be tested every 6 months for potential liver cancer as a result, but liver cancer can develop spontaneously. Did I do a good job of summarizing?
Excellent. I'm so impressed. I can tap out now. Thank you.
No. I have people mess up. I have drinking and everything, eating chips and drinking at the same time. It'll be all bad if you leave it up to me. So, all right. So we're here on Black Doctor. It's one of the things we always talk about when we talk about medical conditions. We talk about the impact that it has on the Black population. And so are there some diseases or conditions that impact the liver that are specifically kind of more prevalent to Black people, Black populations? Are we more susceptible to certain types of liver diseases? Are there any differences between, our ethnic group, our Black populations, and kind of white majority population?
Well, historically, and I guess in current day, as Black people, we are often without the resources to get the medical care and attention that we need. Often our areas are underserved, and sometimes we are late to the game. When we present with a problem, it is way too far gone. Something that could have been identified early fibrosis is now full-blown cirrhosis needing a liver transplant. But
Right.
if I had to pick some of the diseases with regards to the liver that seem to impact the Black population a little bit more prevalently, it would be hepatitis C, hepatitis B, and alcohol.
Okay.
And so if we look at that, we know that at least hepatitis B, there's many endemic areas, especially in Africa. So when we have Black people affected with hepatitis B, we really put a laser focus on them for cancers and ensuring that they get treatment right away and they're monitored for cancer because they're just higher risk. Hepatitis C, particularly with IV drug use, and there's a higher risk in that population there. And many of the studies that we've looked at with the treatment for hepatitis C had, especially in the populations that were in either methadone clinics or needle exchange programs, were a high population of Black people, unfortunately. And then, of course, alcoholism, which impacts us all. But if we're going to pick something where cirrhosis or liver disease is disproportionately affecting our Black population, we would choose alcohol as well. Okay,
so there it is. And I think you mentioned a point, but I'm going to reiterate that point is there's a longer delay, right? In terms of when we start having some discomfort and before we present to the doctor, right? And so if we're not going to get our annual checkups, if we're not visiting our doctor, if we feel something is wrong in our gut, and I said this last night on the program, I said typically when we feel something kind of wrong in our gut, we go get some ginger ale and some saltine crackers and just hope it goes away. And that's not necessarily the treatment for it. We need to make sure that there's not something more significant. And so when we do go to our doctor, when we do go to our primary care physician, are there some tests? Are there some tests or anything that we should be looking for? Are there some numbers that we should know our functioning should be under? So like we know if we have cholesterol, we should be under 200. So is there something that we should be asking our doctor specifically when they do our blood work that would be an identifier for poor liver health?
Okay. Well, first I want to just flip back to one of the things that we kind of touched on is about symptoms. Liver disease often has no symptoms. It's
Okay.
a very quiet disease. That liver is lurking in the background, just chilling. And then when something is wrong, a cancer or cirrhosis, and now the liver is not working, this is when symptoms present. So that's what we kind of alluded to, that we're kind of late in the game because there are no symptoms. So you just have to be real with your risk factors. So
Okay.
if you're an obese diabetic with high blood pressure, high cholesterol, see your doctor, have them check your liver out. Make sure you don't have non-alcoholic fatty liver disease. If you drink a lot, you're a man and you drink at least 2 a day, 14 a week, that's a little excess. That's heading into the excess zone. I mean, it's still, but it's getting there. And for a woman, if you're drinking at least one a day, 7 more a week, you're kind of crossing over into the excess zone. It's easy to do. I'm not going to lie, but if you know that you drink in excess, it might be important for you to check in with your
pandemic drinking. It's that pandemic drinking, Doc.
That's right. The pandemic really did put it. I'm not going to lie. Margaritas by the pool.
Yeah.
But it's probably important now more than ever to check in. No, be real with yourself. You're involved in some habits. You've been experimenting with some drugs. Shared a needle or two, just pandemic style. But whatever. Right. You want to make sure you check in with your doctors and be honest with yourself. Now, as far as, is there a lab or a test or something that's readily available to test for your liver? The answer is kind of yes and no. Your doctors aren't just going to pick out of the hat some just generic testing to have for you. But if you're a baby boomer, or you've been exposed to a needle, or you've had a blood transfusion back in the 80s, and you want to get checked out, yes, they'll probably run a hepatitis panel on you to see if there's hepatitis A, B, C, etc. We do have a liver enzyme panel. It's called a LFT, liver function test. They can test to see if there's any irritation in the liver. Some of those numbers may be abnormal, but sometimes those numbers might be normal and you still can't really tease it out. So you just have to keep on monitoring. And then now in the last 6 years or so, there's a technology called a fibro scan. It's an elastography piece of machinery. And what it measures is whether or not the liver is fibrosed or whether it is stiff. So it measures the elasticity of the liver. A vibration is emitted from the probe. It travels across the liver and it measures how hard or soft the liver is. This technology is not always readily available in your communities, but if it is, it's definitely a cool tool to measure the stiffness, and it can also measure the fat content in the liver if there's any.
Oh, wow. Okay. So the sad news is there's no symptoms. So it's not like you're going to be sitting on your couch and have some pain in your abdominal area and say, oh, that's my liver is acting up. So that's the sad news. The good news is that if you have some of those risk factors, and so that's where Dr. Gunn is talking about being honest with your provider, is that if you are drinking a lot, or if you are a recovering alcoholic, you might want. Sorry about that. Technology just happens. just mid-sentence. Gotta love technology sometimes. But yeah, so all of those things when we're talking about, if you're a former drug user, or if you're currently using, you might want to get that checked out. Also, the good news is that you really have there's some great technology that's out there that might be available in your area. I would say if you probably live in a metropolitan area, it's probably more available versus if you live in a more rural area, that they can do some really kind of cool testing of the liver to make sure that it's got the elasticity and it's not having that fatty tissue there. So you've mentioned this earlier in the program, and I see your questions, guys. So we're going to get to the questions a little bit later. But you talked about fatty liver disease or non-alcohol related fatty liver disease. So what is fatty liver disease and why is it increasing?
So non-alcoholic fatty liver disease, so we're definitely making that distinction that this is for those who don't drink alcohol in excess, is a condition in which excessive fat starts to inundate itself into the liver cells. And the liver is a very lean organ. It really can't tolerate more than about 5% of its tissue being consumed by fat. And when that fat starts to irritate the liver, it causes inflammation, hepatitis, and then ultimately leads to fibrosis and scarring, which continues on the path to potentially cirrhosis. And the risk factors for non-alcoholic fatty liver disease are the obvious, being overweight or obese, but also metabolic syndrome, which includes diabetes, high blood pressure, high cholesterol. And those things, any combination of those things can increase the risk of the liver developing this condition, which can lead to the severe form, which is called NASH. Non-alcoholic steatohepatitis is the term. And so if you have fatty liver disease that has gone bad or has gone rogue, we call that NASH. And NASH is the condition that then can develop into the fibrosis and the scarring that can lead to cirrhosis.
Okay, so any of those of you all that grew up poor or just like liver and onions, and I understand what it is, how lean a piece of liver is. And so that's very, very similar to what's in our body. It's not a lot of fat in it. It's very, very dense organ. And so
that's a great example.
So that when fat gets into that organ, that's not a good thing. Right. And so if you're eating liver, maybe for flavor, but if you're not eating liver, if it's in your body, you don't want that fat in your liver. You want your liver to be as lean as possible, because again, as we talked about throughout this program, it can impair the liver functioning in many areas, because that liver is designed to be the detox center of your body. And so it's got to be high functioning in order to detox. And so a couple more questions, and then we're going to get to the remaining questions from our audience. So I know one of those things that I've always, cognizant of is like if I'm having pain, and I always think about the different medicines that we take, over-the-counter medications that we take. So, and I've always in my head, what's been burned into my head is, okay, your anti-inflammatories can have an impact on your kidneys, and acetaminophen gets processed in the liver. And if you take too much of that, it can have an impact on your liver functioning. Is that true, or is that just kind of a generalized tale that gets told to among friends at the barbershop?
No, well, there's a lot of truth to it. So one of the things that if you overdose on Tylenol, you definitely could put your liver in trouble and to the point where it fails and you need a transplant. So it's very important that you read the label. On the Tylenol label, it says do not exceed 4 grams a day. And so whenever you're taking something for pain, you want to be sure that you're taking it sparingly, that it's not something that you're reaching for around the clock, and also that you're not taking Tylenol and then going and reaching for that Percocet that was in your grandmother's cabinet, because that has Tylenol in it too. Okay. And so then you're inadvertently double dipping on the amount of Tylenol you're taking in. So Tylenol is safe if taken in the correct recommended doses. If you have cirrhosis, however, then your liver doesn't work well already, so you cannot take the normal person's dose of Tylenol. You would have to cut that dose by 50, 60%. Okay. So that is what it is. It's not that Tylenol is unsafe in any way, but in excess, in high concentrations, yes, it can be harmful for the liver. And same thing for the NSAIDs, the non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, Aleve, naproxen, those kind of things. They do have the potential to hurt the kidney. So again, taking them sparingly, not exceeding the doses that are recommended, trying to ensure that you're not double dipping with something else that you didn't know contained that same product.
So yes, so thank you for that well thought out answer. I'm hearing the short version is if you have pain that's prolonged, go to a doctor to see about getting rid of that pain versus just masking it with a painkiller, like acetaminophen or anti-inflammatories. The doctor might prescribe it for a short period of time, but if that's what you're reaching for all the time, then you might want to look to what the source of that pain is and why that pain is happening, either for a prolonged period of time or if it keeps recurring, you might want to look at other options versus just keep taking something that could potentially damage your liver, kidneys, or other organs in your body. Okay, so last question from me, and then we're going to get to questions from the audience.
I did want to say one thing, Ellis, before you run into that last one.
Yes.
We talked about how liver disease doesn't have symptoms, but we didn't talk about what the symptoms of the liver disease, what symptoms liver disease does have when it is in its worst form. Okay. And I think that really warrants a small discussion. So yes, if you have liver disease and it has progressed to cirrhosis, what things you can see or you can witness. So say you got an uncle, he drank all his life, he's an alcoholic. And now suddenly you notice Uncle Billy is always confused, unsteady on his feet, jaundice, yellowing in the eyes or the skin, ascites, fluid building up in the belly where he looks very much like a 9-month pregnant woman, or skinny legs, skinny arms, loss of muscle mass. Those are all signs and symptoms of cirrhosis gone bad. Swelling also is another one. And the last one, which is probably the most fatal or catastrophic, is internal bleeding or bleeding from the GI tract. So vomiting bright red blood or having a bowel movement that looks sticky and tarry. That could be a sign that there's some bleeding going on inside. And those are all parts of cirrhosis decompensated or gone south.
Well, that's great. I'm glad you brought that up. So thank you for that, because we do want to try to find some signs, but that's kind of those extreme signs. If you have like that stage 4, which is cirrhosis in terms of scarring, fibrosis, right. We're learning.
Yes, you are.
We're learning today. So that leads. That's good to know. And that leads to one of the questions that were coming from the audience: is that can cirrhosis be healed or reversed?
That's a question we get all the time. So like I said, the liver is very regenerative. It is one of the few organs, the only organ in the body that if you cut it in half, it can regenerate, it can grow into its full size once again. And in fact, that is so very true that even if you needed a liver transplant, say a cousin of yours wants to donate half of their liver to you, that's something that we're doing in the United States and beyond pretty routinely, and that's a living donor liver transplant. But that's beyond the scope of this discussion. But to the question related to can cirrhosis be reversed, the question is, it depends on how far along it is. If you have cirrhosis and now you're decompensated, now the liver is really just overtly not working, a lot of times that's not reversible. That's a condition that's going to warrant itself into needing a liver transplant, a new liver to be replaced. If you develop cirrhosis, however, but you're able to kind of pull away whatever it was that caused you to get there, yes, the liver can recover, it can regenerate. So for example, hepatitis C. You had hepatitis C for years. Your liver has become cirrhotic, but it still functions, it still works. Now you're lucky enough to get a treatment, you cure the hep C. Hep C is out of the body, the liver starts to heal and it softens up and it kind of comes back to you. Same thing with alcohol. You might have drank all the way to the point of almost no return. Liver is cirrhotic. Now you change your life. You got saved. You got, down where you're not going to drink again.
Right.
You take away the alcohol and you're diligent about it. You don't ever drink. The liver starts to recover. It starts to slowly heal. And sometimes it may always look a little bumpy. It may always look a little scarred, but the function has recovered and it's still showing that it's working well. And that's all that matters.
Okay. So it sounds like the liver is really remarkable in the fact that, it's really remarkable in terms of in its regeneration properties. Like you could take a half a liver and grow it into a whole liver. That is unique. I think that's the only organ outside of the skin that has that kind of regenerating properties.
That's fascinating. It is.
well, that's good news for us, right?
Yeah.
In terms of our functioning. Now, that doesn't even go out and damage your liver, because it can grow back, it can heal itself, but it's just,
this might resonate with someone in the audience if they have someone who's very sick and needs a liver transplant, and say the cadaveric liver transplant list is so long, meaning a person has to die so that you could get their liver. That list is so long, and there's not enough livers to go around. But the living donor opportunity is out there, meaning that someone who shares the same blood type as an individual in need could make the ultimate sacrifice of allowing a portion of that liver to be shared, of their liver to be shared. So something to know and explore.
And is that match process similar to like a match for somebody who wants to donate blood marrow or something like bone marrow or something like that?
So the match process for the liver is actually less involved than a kidney. As long as they share the blood type, that's usually all that's required. Kidneys are a little bit more involved, like more than blood. There's more immuno matches that need to be in place, but a liver is a lot easier in that regard.
This is a most fascinating discussion about the liver. So of the few cancers that are on the rise, liver cancer is one of them. Do you have any thoughts as to why that is?
I think it's mainly what we're finding is, well, first of all, as I mentioned before, one of the precursors to liver cancer is cirrhosis. Although we can develop cancer spontaneously in the liver, cirrhosis is usually like that predetermining factor. And what we're seeing is, as we get older, diabetes is on the rise, obesity is on the rise, this non-alcoholic fatty liver disease is on the rise. And I think that is what's creating a platform for more prevalence of liver cancer. Now hepatitis C and alcohol are hepatitis C is coming down now that we have treatments. Alcohol is kind of teetering, but now this non-alcoholic thing is coming up. And we as Americans are the American diet, that Western diet is like supersize me or I'm not paying for it type of thing. and so I think we're seeing kind of the devil in our culture and in our ways about nutrition.
Yeah, and that's unfortunate. Oh, there was a great question from the audience. It says, can you address what jaundice looks like in a person of color? It looks nothing like what we see in the literature. And so, yeah, it's probably easier to see yellowing on somebody that has kind of fairer skin.
Yes, yes.
But what does jaundice look like in a person of color?
Well, that's an excellent question. And being a Black person, I ask the same question. It's not going to look like the same on me so the eyes for sure give it away. Okay, so you're definitely going to kind of pull down those underlids, look and see if the conjunctiva is yellow, if that the pinks of the eyes are yellow. That's one. The other thing is open the mouth. Everybody's tongue looks the same, so the tongue and the cheeks will be yellow inside. So that's another way. And then some other ways are kind of like the palms of the hands and things. There's a lot of places where the excess bile will deposit that you'll be able to see the jaundice pretty clearly in people of color.
Okay. So, yeah. So that was a great question. I was like, I got to make sure I got to get to that question because, yeah, absolutely. So eyes, tongue, inside of the mouth, maybe palms of the hands, those kind of universal areas that are typically the same color across all ethnic groups. Right. You can see the yellowing effect happening. And then I think you said some of the other symptoms are like if they're the thinning of the arms, the muscular areas in the arms and legs, that big protruding stomach, that just really is over the top, kind of big, and it's disproportionate to the body. So like it's different than an obese person because this person might have skinnier arms and legs, and then they have this large protruding stomach. That could be a sign of liver issues.
That's right. And then to the jaundice question also, it's also when a Black individual is jaundice, yes, you're going to probably notice it more on the whites of the eyes and the inside of the mouth, but also you'll kind of see a dusky appearance to their skin. Their black isn't their normal black, and so you'll pick it up, especially a family member too. They're going to be like, he don't look right. That's not his normal skin tone. Right. So you'll pick it up in your loved
That's an excellent point. When somebody don't look right. Come on.
Ashen.
Right, right. And lotion ain't gonna do it. Like
Right.
you don't look right, so you know what it is. So yeah, so
Right.
um, I think what's important. I think what we're saying is at the end of the day is trust your gut. And if you see somebody, a friend or family member that doesn't look right, and particularly if you know their history, like if you've got a family member that you know has struggled with alcohol throughout their lives, and then they show up, at the family reunion, and they may or may not, they may be off alcohol, but they're not looking right. You might want to say, "Hey, have you been checked out?" So trust your gut on that in terms of, it's better to be wrong and checked than right and not checked, right? And have to go, I should have said something, right? You don't want that guilt on you. So just check, and even for yourself or for a friend or family member, make sure you go get checked and refer them to this video. This is going to remain on Black Doctor website. It's also going to be on our YouTube channel. You can always refer back to it. We're going to re-air it from time to time. And we've got 2 more in this series of programming about liver health and liver functioning. And so it's really important because as we learned today from Dr. Gunn, it's like the liver is so important to our daily lives that we can't overlook it. And I know we focus a lot on the kind of the big illnesses that impact our culture. And that's, of course, the diabetes and high blood pressure. Those are kind of the 2 big ones. And then when we're talking about cancer, we got breast cancer and prostate cancer, those kind of the big ones. But there are other areas of the body that are just as important in terms of functioning. And we've got to make sure that they're functioning at a high level to be safe. So thank you, Dr. Gunn. This has been one of the most fascinating conversations I've had in a very, very long time, and just really so impactful. Are there any kind of last minute things? So we know if you've got some of those warning signs, be honest with yourself and be honest with your primary care provider. So when that form that you fill out, y'all know you fill out that form and it says how many drinks that you have per day, put in the real amount. Put in a real amount, because that's going to impact your treatment. And then you can't blame them if you put less than 1 drink per day and you're knocking back 2 or 3. Like that's minimizing it to look good in the moment or to look healthy in the moment could have a long-term effect on your body. And so make sure that is what you're doing in terms of, also make sure you're going to go see your primary care provider on a regular basis. If that's just for your annual checkup and get your lab work done, make sure that happens, right? And then tell them what's going on with you. One of the best things that I started doing was I started writing down. If I have, a pain here or something's going on with me and I have that list, and I take that list in with me when I go to the doctor. So I can say, doc, back in June, I had this thing and it went away after a couple of days. But, just because it might seem trivial to you, but they're trained to hear that and go, oh, well, let me check this. And that checking, that when you just mentioning it to them, that checking could save your life potentially. And so you always have to be cognizant of what's going on. So anything that I missed or any last minute thing that you want to make sure our audience knows as we're, coming up to our close?
Well, I think you really summarized it well. I saw a sign yesterday when I took my son to the doctor. It was from the patient advocacy department and it said, speak up. And it basically says, you're your best advocate. You have to speak up. If somebody writes your medication down wrong, if they heard you say something that you didn't say, if you're not sure about the instructions on your medications, you have to speak up. And so I think that when we talk about advocating for ourselves and not kind of trying to make the paper look good to the doctor when know you're really drinking more than you should, you got to speak up. You have to put it out there. Nobody's there your doctors aren't judging you. They're just trying to be partners in your health. Right. And so do that. And then the other thing is with liver disease, because it could be kind of quiet and progressive and such, it's oftentimes a family member that's going to be the one that recognizes some of the signs, especially when it comes to the confusion that liver can bring. Oh, mom is just not as sharp as she once was. She's always so forgetful, or I noticed that she's just stumbling around a lot, but it's not every day, but I don't know. Like, you need to kind of step up and speak up for that family member. They may not recognize inherently what's going on, but you see the differences. So do be an advocate for your friends and your loved ones and speak up.
Absolutely, absolutely. So this has been a wonderful discussion. Thank you, Dr. Gunn. And I'm going to just throw one more parting shot. We didn't say don't take herbs. We're just saying take them at your own risk at those supplements. And so because they're not FDA approved, so I would suggest before you just go into your health food store and start taking random herbs that they recommend, I would say take them and have a conversation with your medical professional before you start taking supplements and things like that to improve whatever functioning you're trying to improve.
Absolutely, because we have to know that some of these things can harm the liver, and being that the liver is the only organ that's doing all the cleansing and clearing, we want to make sure that it's safe. And then it's not a problem to bring your new interest of a supplement or an herb to your doctor and say, what do you think of this? Do you think it's okay? I've given the okay on some things, and there's a lot of things that I'm like, I don't know. I'm not really sure about this. I don't know what this ingredient is. So, so do make sure that the conversation is open. You have a dialogue with your providers.
Absolutely, absolutely. So again, thank you all for joining us today. Really, really enjoyed this conversation. Again, we're going to replay it. So and it's also going to be on our YouTube page as it renders over there. So you can always go there, look under. There's a playlist called Medical Conditions, and it's going to be right there under our Medical Conditions playlist. So thank you again, Dr. Gunn. This has been a wonderful discussion, and we look forward to seeing you in the future.
Thank you so much. Bye, everyone.